Tell me when you're ready.
We're ready. And you're gonna look right into the lens. All right, I'm speeding.
Could you finish the sentence? To me, equity means.
All right, let's think about that for a second.
So many answers to that.
To me, equity means ensuring that all of us have a voice in choices that we make.
Every person, every family, and community has the full opportunity.
Barriers are removed.
The opportunities are the same regardless of background.
My career began in pediatrics, trained at Johns Hopkins, and then worked in community health centers and juvenile prisons, public schools in Boston, and then came back and did child psychiatry training. And then was really interested in this space of how to get in the room, how to be at the table when people were making decisions around policies and allocation of resources and making decisions that were going to impact my patients and the care I gave, but I didn't see people like me that had the kind of perspective I had at the table. There was a clear need for increased representation in policy discussions, and a program needed to be developed to both identify individuals and help prepare them so that they could be future leaders.
The program got off the ground with two vital elements. One, a leader of great capability and passion in the form of Joan Reed, and the second was the financial support that the Commonwealth Fund was able to provide. It was unusual for the fund at that time, and it is unusual for a philanthropy to stay with a single program for 25 years.
I was approached by the Commonwealth Fund to say, do we need something that will help identify and train leaders, diverse leaders? And if we do need that, what should the structure of that be? Fellowship at Harvard University focuses on minority health policy, focuses on identifying, supporting, creating leaders who are prepared to step into health systems to create change that leads towards equity and social justice and improving the health of marginalized and vulnerable populations. When I think about leaders and the Commonwealth Fund Fellowship, they're individuals who are willing to go places that we haven't gone before.
When I was a little girl, I would dance around with my dad's stethoscope around my neck. My dad is an amazing role model of what it means to be a doctor and to take care of people. I couldn't imagine doing anything else.
Growing up as a young child, seeing my relatives suffer from many chronic disease was very disheartening.
As an immigrant, I've always known that people were treated differently. And so I always wanted to be a resource for communities.
By becoming a physician, I felt like I could make the greatest impact in the overall healthcare and well-being of American Indians.
I am a senior advisor to the Assistant Secretary for Health.
I am currently the chair of the Department of Emergency Medicine at Boston Medical Center and Boston University.
My work focuses on the intersection of adolescent mental health, substance use, and juvenile justice involvement.
I really like taking care of women because I think they are the crux of our society, the backbone of our community.
I'm particularly thinking about how do we reduce the inequity in access to Spanish-speaking patients and families.
If you were to poll or look at all of the fellows that have come through and the current fellows that are present, they've all had an idea of there's something else that can be done to improve the systems that we have.
So I think it's a unique opportunity because there's so many other individuals that have just really laid the foundation so that this fellowship could exist and really grow into what it is today.
I realized it was about policy and it was about resources. And so I wanted to learn how to make changes in those systems.
It's just an exciting time to be able to use those skills and move things forward.
When you come into the fellowship, you're actually part of a family.
And then once you enter that door, you have this community of people, the past fellows and current fellows who are going to help you and walk along with you.
That type of exposure is the type of exposure that I think we all needed as fellows to be able to go on into our future career.
Being a part of the fellowship was a great way to see that there's many other people excited about doing the same work that you're doing, and remembering that there's power in numbers to collaborate, work together on different projects or initiatives, and really helps kind of reignite the passion and purpose of what you're doing the work for.
Probably one of the things that's most important in the fellowship is the fellowship of the fellowship. And they become friends, they become a family, they become a support network that is rare.
I think that's the testament to this fellowship, that they were so forward-thinking 25 years ago to be saying, this is where we need to be, this is the community that we need to create.
The program has matured. It's also, as we know, spun off a new branch in the form of a Yale Fellowship with a slightly different emphasis and a slightly different tone, but it is very much inspired by the Harvard program.
I think the greatest impact with the fellowship program is just the continued relationships that people have with each other.
This is one of the unique aspects of the fellowship that sort of comes together naturally because we all recognize the value of mentorship. We all know that we wouldn't be here without the support of others.
This fellowship was my stepping stone to advance from having impact at the community level, then at the state, and now at the federal level.
We still have so much work to do, but because of the growing numbers of people who are aware about the issues and who are working to change it gives me a lot of hope. When people can all come together with the same goal, from different perspectives, from different lines of work, different institutions, all with one aligned vision of improving health equity, that's how things get done.